In 1944, Dr. William Sansum founded the Sansum Diabetes Research Institute right here in Santa Barbara. The work and research that they do is invaluable to the community.
And this morning, we are joined by Dr. Kristen Castorino, SDRI Senior Research Physician. She works to support low-income minority women who have pregnancy complicated by diabetes. Good morning, and thank you for joining us.
Thank you so much. It's a pleasure to be here.
Yes, and my first question is, can you tell our audience a little bit about Sansum Diabetes Research Institute and the groundbreaking research that shapes the current protocols for diabetes care?
Absolutely. So one thing that people don't realize about us is that we're small but not mighty nonprofit research institute, and we're not actually part of Sansum Clinic. We're our own separate organization, and we have been working on diabetes research really since the very beginning of when William Sansum founded the Research Institute as well as the clinic and first produced insulin. And what we get to do now is work on developing the latest, greatest technology. So anywhere from insulin pumps, continuous glucose monitors, the latest, smallest, best ones as they keep getting better. And then we're also get to work on what is the best practice for really high quality diabetes education. So anywhere from, the high tech to the high touch.
Okay. What are some important pearls about diabetes during pregnancy, you think?
That's a great question. And that's ideally you can plan a pregnancy, but that doesn't always happen. But if you can, it's best to get yourself as healthy as possible before pregnancy. And know that if you're at risk for gestational diabetes, you should check to see what your blood sugars are, or what your A1C is. Another important pearl is that we're stricter in pregnancy. Blood sugars have to be in the near normal range, whereas when you're not pregnant and have diabetes, we're a little bit more lenient.
And that makes sense. I mean, you've been with the company you mentioned for 15 years, so you've seen it kind of evolve and grow, and the research grow and evolve as well with that.
Right.
And can you elaborate on the current initiatives SDRI has implemented for diabetes in pregnancy?
Yes, I love to call these our triplets. We've got 3 very important studies that we're working on. And I don't think we have enough time to go all into the details, but one of them is about education and improving education in our Latino women who are dealing with pre-existing diabetes in pregnancy. And the other is to rethink that oral glucose drink, which is gross. No one wants to do it. There's got to be a better way. And so those are 2 of the studies of our triplets, and we're really excited to help improve not only access to education in pregnancy as well as technology in pregnancy to have healthy babies.
Yeah, that's amazing. I mean, that is the goal, always.
Yes.
Just a broad kind of overview, the history of diabetes and pregnancy, how they work together, and what you think our people should know that are watching.
Yeah, that's a great question. And so my mentor is Dr. Lois Jovanovic, and when she started out in the field of diabetes and pregnancy, people didn't even routinely screen for diabetes. And she helped the world understand how important it is to identify, diagnose, and then do a really good job of treating. And so, I like to say we're standing on her shoulders and on her legacy of just continuing that work. Now we see it's routinely diagnosed, but there's a lot more to do in terms of treatment.
Yeah, definitely. Well, thank you so much for all you do in our community, the research, and for waking up so early with us today. Well, if you're all interested in more information, visit www.sansum.org. Dr. Castorino, thank you again for joining us here today.
Thanks for having me.
Of course.
Good morning, Ann.